Hello, my name is Kiran Madiwal and today I am presenting about the topic chronic pyelonephritis. Let us firstly talk about the introduction part of the chronic pyelonephritis, then about the whom to chronic pyelonephritis affects, and then about the types, diagnosis, treatment, and about the gross and microscopy. Let us start. The introduction is it is the chronic inflammation of the renal tubules and the interstitium with scarring and deformity of the renal calyces and the pelvis. This is occurs due to the recurrent attacks of inflammation and scarring, and it is the commonest cause of end stage renal disease, which is also called as ESRD. And due to this chronic pyelonephritis, the nephron loss will be there. And let us see about whom does it affects to. It is more often affects in the infants and the young children. Children with the congenital anomalies of urogenital system and the person with flaccid bladder due to spinal cord injury. These are the people to whom these pyelonephritis will affect. Okay, let us move forward. And based on the cause, it is of the two types. Based on the cause of the pyelonephritis, it is divided into two types, which is the chronic obstructive pyelonephritis and the reflux nephropathy, which is the chronic reflux associated pyelonephritis. It is also called as chronic reflux associated pyelonephritis. Let us see about the chronic obstructive pyelonephritis. It is the obstruction to the outflow of the urine at the different level predisposes the kidney to infection. The recurrent episodes of such obstruction and infection result in renal damage and scarring. Rarely, the recurrent attacks of acute pyelonephritis can lead to renal damage. Any disease, we can call it as chronic when the duration of the disease is more. Hence, it is chronic pyelonephritis. It can be as the congenital anomalies of the urethra, or it can be unilateral as with the calculi or the tumors. It can be bilateral as the congenital anomalies of urethra and unilateral as with calculi or tumors. Let us see the reflux nephropathy, which is the second type of the chronic pyelonephritis, which is also called as the chronic reflux associated pyelonephritis. The commonest cause of the chronic pyelonephritis, it is results from the superimposition of urinary tract infection on the congenital vesicoureteral reflex, which is called as VUR, and the intrarenal reflux. Reflux of urine up into ureters during the micturition manifests in the early childhood. The incidence of reflux according to sex is equal in infancy, but after infancy, both pyelonephritic scarring and reflux are far more common in females. Hence, we understood that it is more common in females. Infection is the likely cause of progressive scarring in females. Let us see further about the chronic pyelonephritis, which is the congenital absence or the shortening of the intravesical portion of the ureter. Here we are seeing about how the damage of the kidney and the scar formation occurs. Let us see. After the congenital absence or the shortening of the intravesical portion of the ureter not compressed during the micturition, hence the reflux of urine into ureters. Reflux results in the increase in the pressure in pelvis so that the urine is forced into the tubules. Hence, this forceful urine damages the kidney and it will lead to the formation of the scar. Let us see in the diagram of the vesico-ureteral reflex in the next page. This is the diagram of the vesico-ureteral reflex which is leading to the chronic pyelonephritis. And the chronic pyelonephritis by the obstructive uropathy also showing this diagram, which is showing that it contains of the normal cortex, normal capsule and thin cortex, but it leads to the vesico-ureteral reflex which is leading to the reflux of the urine into the ureters and the damage of the kidney and irregular scar on the pole. Now, by the second obstructive uropathy, due to the obstruction of the ureter, which will lead to the dilated pelvis and the thickening of the capsule, diffuse uneven scarring will occur, same as the thin cortex, but here the calyces will be dilated because of the obstruction of the ureter. These urine will accumulate in the calyces and thinning of the thin cortex and diffuse of the uneven scarring will occur. These are the two major types of mechanism which is present in the chronic pyelonephritis. Mainly the vesico-ureteric reflex causing infection of the peripheral papillae and consequent scars at the poles of the kidney. Obstructive pyelonephritis is due to the obstruction of the urinary tract which is causing high pressure backflow of the urine and infection of all the papillae and consequent diffuse scarring of the kidney and the thinning of the cortex will occur. Now let us see about the morphology of the chronic pyelonephritis in the further slides. About the morphology, we will discuss about the gross features and the microscopic features. The gross is uneven scarring of the kidneys, unlike the symmetrical as in the case of chronic glomerulonephritis, which is the uneven scarring of the kidneys. And the hallmark is the scarring involvement in the pelvis or the calyces, or both leading to papillary blunting and marked calyceal deformities. The microscopic features is the uneven interstitial fibrosis will occur and the inflammatory infiltrate of the lymphocytes and the plasma cells will accumulate. Dilation or the contraction of the tubules with the atrophy of lining epithelium. Sclerosis of the glomeruli will be there and tubules may contain pink to blue glassy appearance which is the PAS stain positive casts known as the colloid casts that suggest appearance of thyroid tissue, hence descriptively called as thyroidization, which looks like the thyroid. It is the gross appearance. You can see that the uneven scarring of the kidneys, unlike symmetrical, as in the case of chronic glomerulonephritis. In chronic glomerulonephritis, you see the symmetrical, asymmetrical. Here is the symmetrical. The hallmark is mainly the scarring involvement in the pelvis or the calyces, which leads to the papillary blunting, which I have explained earlier in the slides, and leads to the marked calyceal deformities. This is the adult kidney. Now we can see the microscopic features of the chronic pyelonephritis in the diagram. This is the cystically atrophic tubules which you are seeing in the diagram. This is the cystically dilated atrophic tubules which is dilated and looks like the cyst. And the tubular atrophy with thyroidization will also be there, which is these tubules contain glassy appearance, which is the PAS positive, and pink to blue. As you are seeing, it is pink to blue glassy appearance is there. Hence these looks like the colloid casts. Hence we are saying that tubular atrophy with thyroidization. And you are also seeing the chronic interstitial inflammation, which the lymphocytes and the plasma cells, sorry, which the lymphocytes and the plasma cells infiltrate will be there. And as I have explained earlier, also the small atrophic tubules will be there. These are the small atrophic tubules. As we are moving further, we see that which are the predisposing factors of the chronic pyelonephritis. Factors that may affect the pathogenesis of chronic pyelonephritis are as follows. The first one is the sex of the patient and his or her sexual activity. And the second most thing is the pregnancy, which may lead to the progression of the renal injury with the loss of the renal function. Because of the pregnancy, the pelvic pressure will increase and it will lead to the increase in the pressure of the urinary bladder. Hence it is the most important predisposing factor for the chronic pyelonephritis. And some of the genetic factor is also the predisposing, and chronic bladder infection will also cause to chronic pyelonephritis, and the neurogenic bladder dysfunction, which is mainly from the paralysis from the spinal cord injury or the tumors. The catheters, tubes, or surgical procedures may also trigger a kidney infection. Hence, it can also lead to chronic pyelonephritis. In case with the obstruction, the kidney may become filled with abscess cavities. Let us move further about the clinical features of the pyelonephritis. The clinical features are may present with fever and the flank pain. The person may present, and the person usually present with chronic renal failure. As you are seeing here, she is mainly suffering with the chronic renal failure, or maybe the symptoms of the high blood pressure or the hypertension. Mainly, the person is present with the fever and flank pain. Here, this diagram shows that the person is present with fever and flank pain, and the frequency of micturition will increase and dysuria will be there. Frequency of micturition and dysuria will be there. Let us move further about what are the complications of the chronic pyelonephritis. The complications are the proteinuria. The protein can be excreted in the urine, and focal glomerulosclerosis will be there, and progressive renal scarring leading to the end stage renal disease, and the papillary necrosis, perinephric abscess will be there. These are the complications of the chronic pyelonephritis. Let us move further to diagnosis and the treatment part of the chronic pyelonephritis. The diagnosis is mainly we do is the urine analysis and the intravenous pyelography and ultrasound. These are the diagnostic procedure for the finding out the chronic pyelonephritis. And moving about the treatment part, we mainly give is the antibiotic therapy and the relieve the obstruction. As you have seen in the earlier slide, because of the obstruction of the ureter, also the dilated pelvis will be there, and chronic pyelonephritis will occur due to the obstructive uropathy. Hence we have to relieve the obstruction by the procedures of the treatment, and we will give the analgesics for the relieving of the pain, and the role of the surgical correction of the vesicoureteral reflex, which is the moving of the urine backwards to the kidney or the normal cortex or the normal capsule, which leading to the thinning of the cortex and the scar formation or the irregular scar or the fold formation remains uncertain, but meticulous control of infection appears to prevent progressive scarring. Let us move further about the treatment part of the chronic pyelonephritis. We should take the fluid intake and the cranberry juice, and we should do the pain management about the chronic pyelonephritis, because it can lead to the severe pain in the micturition process. Let us further move to the variants of the chronic pyelonephritis. Two variants of the chronic pyelonephritis, which are the xanthogranulomatous pyelonephritis and the emphysematous pyelonephritis, due to the diabetes mellitus, which you will study in the further education. Let us see about the tuberculous pyelonephritis, which is the tuberculosis of the kidney, occurs due to the hematogenous spread of the infection from another site, most often from lungs, less commonly from ascending infection from the tuberculosis of genitourinary system, such as from epididymis or the fallopian tube. The renal lesions in the tuberculosis may be in the form of tuberculous pyelonephritis or the multiple miliary tubercles. Let us see further about the morphological features of the tuberculous pyelonephritis, which is also the chronic pyelonephritis. Gross features is the bilateral, which is usually involving the medulla with the replacement of the papillae by the caseous tissue. Caseous means looking like a cheese. Huge number of small scattered granulomas will be seen in the gross appearance. As you are seeing in the figure, huge number of small scattered granulomas are seen. Moving to the microscopy, typical caseating epithelioid cell granulomatous reaction is seen, which is we are seeing the typical caseating means the cheese like looking like a cheese granulomatous reaction, and also it can be demonstrated. Let us move further about the clinical features of the tuberculous pyelonephritis. The clinical features are the persistent sterile pyuria and the microscopic hematuria. There, in the microscopy, we can see the blood particles or the RBCs in the urine, which is also called as the hematuria. And in the diagnostic test, the identification of the mycobacterium tuberculosis by the repeated culture of the urine on the Lowenstein-Janssen medium. As you have studied in the microbiology, Lowenstein-Janssen medium is used for the mycobacterium tuberculosis for the diagnostic test. These are about the chronic pyelonephritis, as we have seen from the introduction, and then about the predisposing factors, morphology and types, and the further about whom it is affecting, and lastly we have seen about the gross and microscopy of the chronic pyelonephritis along with the complications and small topic about the tuberculous pyelonephritis, how it will spread, morphological features, and about the clinical features. This is my topic, chronic pyelonephritis. Thank you.